Good morning. Today I'm going to talk about foreign medical graduates and international medical graduates myths, some of the misunderstandings that these students have, and how they can be cleared. So I have classified that as a myths of FMG that need to be cleared. As a lot of you might know and might be connected with me on LinkedIn or Instagram, or might have seen my YouTube channel on different topics, I do a lot of research. I put in hours of research, try to find out things and give you the evidence and the facts for that. So I'm going to give you some fact-based myths that the FMGs and the IMGs have. That will help you in choosing a good rotation. That will help you in succeeding in the aim that you have. The myth number one is, I want hands-on rotation. Now, what does hands-on mean? Hands-on does not mean that you are acting like an attending physician on the floor or you are the be-all and end-all. No, that's not what hands-on is. Hands-on means you are able to take a history, you are able to do a physical examination independently on your own without the attending physician being there, right? That is why we have malpractice insurance that we provide with clinical rotations, right? So you could do that independent of the attending physician. You can gather labs, information, x-rays, blood work, information on the patient, put it all together and then derive an assessment and plan for your patient and discuss that on the rounds with attending physician and with everybody else on the team, the care team which is on the round. You discuss it with them, interdisciplinary. And that is what hands-on rotation means. That you are under the guidance and you are arriving at the treatment plan for the patient. That's what most of the program directors and programs need you to go through because they want you to be used to that. It does not mean that you need unrestricted access to EMR. No. EMR is not required in hands-on rotation. If you get that, it's a cherry on top, but it is not mandatory. Nobody looks for it. That brings us to myth number two. I need EMR access. No, you do not need EMR access. Every hospital has a different EMR. When you are selected in a residency program, you have one whole week at the beginning through the HR department to get your credentialing done, to get your EMR access, ID, password. With the technical department, you spend 2 to 3 days learning the EMR of the system. So it's not mandatory. Programs don't need you to have EMR knowledge because every hospital has a different EMR. They're going to train you when you are selected in a residency program. So that is myth number two. Myth number three is letter of recommendations. I need them on the hospital letter. I need a university hospital letter of recommendation. No, that is not mandatory, not required. What is important is who's writing the letter of recommendation for you. If it is the designation contained, it is faculty, chairman, head of the department, chief of section, that automatically means that they are holding a position of power at a place. If the programs are in doubt, they can Google the name and see if those people are really chairman or not, right? So the top doesn't matter. You don't need a letterhead. If it is there, it's a cherry on top, right? So three myths. The fourth myth is, I need to do a rotation from Mayo, Yale, Harvard. It is not mandatory to do that. Number one, they cost close to $4,000 to $5,000. And from a lot of you, I've heard that is means beyond. So it is not necessary. Programs are not looking for that. Most of these rotations, mark my word, they are a big group following attending physician at these prestigious hospitals. You go through the corridors, you go through the motion of going through the rounds, you really don't learn much, right? So that is not required. It's a myth. Meaningful programs are looking for meaningful clinical rotations wherein you learn hands-on. Okay, that brings us to the next myth. Info on ERAS application. A lot of times FMGs are trying to be slick and smart and put information that they think programs will not detect. No, be honest and straight and give the right information. Myth number 5. I need to have research. Research is not mandatory. It is an adjuvant. I counsel my students who have got scores of more than 250, 255, 260. Even if you don't do research, you are in a good spot to get selected. So it is not mandatory. It's an adjuvant. It's for people who have lesser scores to make them stronger. Okay? For that extra push, if you would like. So that is the fifth myth. The sixth myth is, and I want you to all hear it very closely, when you enroll for a clinical rotation, you don't own the attending physician. You don't demand things out of them. You don't hammer them. Be nice, polite, because your life depends on the recommendation they are going to do. I've had instances wherein students are, I have paid the money, I need this, I need this. Please, please don't do that. Your life depends on what that attending physician is going to write for you. So these are a few myths I want to clear for you so that you can be successful in your endeavor. Thank you.